Hello and welcome to India Top Doctor. Today we are back with another episode of the Health Dialogue. And today we will be talking about infertility. Infertility affects millions of people of reproductive age worldwide, has an impact on their families and communities. Estimates suggest that between 48 million couples and 186 million individuals live with infertility globally. To know more about this, today we are going to have a little conversation with Dr. Surveen Sindhu. So let's welcome her. So welcome to India Top Doctor.
Thank you. Thank you.
As you know, today we will be talking about infertility. But before we move ahead, can you tell me something about yourself?
Yeah, so I have been practicing infertility now for over 30 years. For me, it's a passion. I've written books on it, I've done research on it, all my work is on it. In this journey of infertility, one has learned many things. And the very important thing which one has learned is that infertility, many people, even the government, does not treat it like a disease. Although it is one of the worst conditions a woman can be under in our country. So it does need a lot of empathy when you're treating it. Some of the treatments are very costly and many of our patients cannot afford it. So we really need to look into this to be able to make all these treatments available to each and every person in India. So as far as I'm concerned, I have trained from Manipal University, Cleveland Clinic. I'm a trained embryologist. I can work in the lab, I can work clinically. And I have in the past 30 years been a faculty over various medical colleges. I'm running a research fellowship in the field of infertility, 1 year long research fellowship. Currently, I am working in Max as director and head of the IVF department.
So that's quite a milestone you have received there. Can you tell our audience what causes infertility?
So, infertility could be either a female factor, a male factor, or both. And many times it is unknown. We call it unexplained infertility, where you cannot identify a factor. So, in the female, it could be blocked tubes, it could be that she's not forming an egg, or she has, premature ovarian aging, or she's reaching in menopause because of which she's not making an egg. It could be some condition in the uterus which is not allowing implantation of the embryo, like adhesions, tumor. It could also be something to do with systemic diseases like severe renal disease, or maybe a thyroid disease or a severe diabetes, which could not allow her to have a baby. The male factors is generally a poor semen count. Either the count is low, or the motility of the sperm is low, or the morphology is poor, or the sperm is absolutely absent, like we call it azospermia. Combined factors could be any of these factors available. It could also be an unexplained factor, like I said earlier. So, in the past 10 years, what we have seen is that the male has become gradually has become more important as far as infertility is concerned. There is an increasing incidence of male infertility, which was not there earlier. Earlier, it was just a 25% incidence of male infertility. Now it's a 40% incidence of male infertility.
Right. So we know how infertility is more of a social issue rather than a health issue. Right. So can you tell our audience why addressing infertility is important?
Yeah. So like I said in the beginning, that it is both a health issue as well as a social issue. So the health issue is definitely there because there is a compromise somewhere. There's the tubes, eggs, or sperms. But it is a huge social issue because for a woman to be infertile, whether even if it is because the man is infertile, for her not to produce, one is that the expectations of the in-laws, of the people around her. Second is her trying to match up to her sisters and friends who already have children. Third is an expectation of the husband from the wife. So she gets stressed out with all these expectations, and she is made to feel that she is the one who is responsible for bearing this baby. So I always tell all my patients that, if a cycle fails, you haven't failed. It's not you who's failing. It could be anything which is failing. So this is very important to, enhance their self-esteem. These women come with a very poor self-esteem because they have been battered by comments and, expectations which they have not been able to reach. So, in fact, I always tell a small incident. I was in a remote, infertility center somewhere. I had gone there to just observe. And there was one woman who had no eggs. She had reached premature menopause. So the husband was told that, you get a donor egg. So get a donor. We'll get a donor for you and we'll do the IVF and we'll put the embryo in the wife. So he said, okay, I'll think about it. He was from some village. After a month, he came and he had his wife, and along with that, he had a young girl. He said that this is the sister of my wife and I have got married to her. I don't need a donor now. So this is the state of affairs in our country. And hence, we need to address this very strongly.
Absolutely correct, ma'am. So we talked about the issue. Can you tell me, is there any way to prevent infertility, or is it genetically something which caused by genetic factors?
So, genetic factors are there as one of the causes, not all. So, one of the causes is genetics, where your mother had a premature menopause, you will have a premature menopause. Or if your father has had some sperm issue, there could be a genetic component to it, which he has passed on to you. But besides that, there are avoidable factors like, excess smoking is one of the factors which leads to a low sperm count and a low egg count. So you reach your menopause much earlier if you're a chained smoker. It also leads to repeated abortions and malformed children. Besides that, if you have conditions like diabetes and all which are not controlled, they will lead to infertility in some manner, whether it is the male or the female. Then anything like your contraceptives, if the ones which you're using, if it's let's say a copper T, so copper T will cause a higher inflammation in the uterus, hence causing a tubal blockage. So not all copper Ts will cause, but there is a minor incidence where an intrauterine contraceptive device can cause a blockage. So we always tell girls who don't have children that use pills, don't use a copper T. When you've completed your family, you use a copper T. That is always better. Then with the male, working on the laptops will cause low sperm count. These days, this is cell phones. There is an issue with that. Stress, high stress in both partners. Again, it's a cause. A poor diet is a cause. Deficiencies in your diet, if you don't have enough antioxidants, you'll have a low sperm count. So there are many factors and they're avoidable, and in some cases they are avoidable, in some cases they're not avoidable.
Okay, all right. So as there is, besides from the mental torture people get, is there any other complications in body due to infertility?
So if you leave aside the, let's say the psychological aspect of infertility, and we talk only about the physical aspect, then it's not that infertility leads to a physical disease. It's that physical disease is present, which is causing infertility. Like endometriosis, which is like an ovarian cyst, may be present, and that will cause infertility. Or fibroids in the uterus will be present, and that will cause. So it's the reverse. It's not that infertility is causing fibroids. No, it is the reverse.
All right, all right. I guess that was a myth you just, broke down right now. Can you tell me what's involved in an evaluation for infertility?
So we evaluate both the couple and both the man and the woman. And we do not start the evaluation till at least 1 year they have tried properly timing their intercourse and still have not conceived. This 1 year we decrease to 6 months if the woman is over 35, because we know she has a limited time of fertility. So we do blood tests on the woman. There is an AMH count, there is an antral follicle count, and FSH. These three tests tell us the egg reserve. We do other tests like general tests, the thyroid, the prolactin, these hormones are evaluated. The kidney function test, the liver function, and blood sugar is evaluated. Her hemogram is done. We do an infection screen for 4 infections: HIV, hepatitis B, hepatitis C, and VDRL. These are the ones which are sexually transmitted. Then we go on to evaluating the uterus and the tubes. We do that by putting a dye in the uterus and pushing it through the tubes and taking an X-ray and seeing the film whether the dye has spilled over. So it will tell you about any intrauterine lesions. It will also tell you whether there's a tubal block. We do a baseline ultrasound which shows us the uterus, whether they are fibroids, whether they are intrauterine adhesions, how is the lining, whether the lining can take the baby. And also we go ahead and do a semen test in a husband. If semen count is very low, we do his hormonal tests, FSH, LH, etc. We also do a local examination for the male to see how the his testes are, whether they are normal size or not. And a scrotal ultrasound can also be done in these cases. A detailed semen analysis is done to see the count, the motility, and the morphology. Morphology is, the shape of the sperm, whether it is normal or not.
Okay, so is there there are, of course, so many treatments. What are all the different kinds of treatments available to treat infertility?
So in the treatments, basically, we start with just simple timing of intercourse if they have not timed it. So we tell them what is the fertility period and what is the ovulation period, and to time the intercourse around it. That is the basic thing. Then second option is to do an IUI or an ovulation induction. So we give her tablets to make an egg, and we do a follicle monitoring to see whether the egg is forming and rupturing and being released into the body. We also do an intrauterine insemination where we time the putting in of the semen, prepare the semen, take the best of the sperms, and we insert it in the uterus at the time when the egg ruptures. So it brings the sperm closer to the egg. It is timed right. Sometimes, couples are not timing the intercourse right. There is only one day in a month when a woman ovulates. And if that day you have not had an intercourse, you probably would not get pregnant. So that is intrauterine insemination. If intrauterine insemination fails, then we go on to an IVF. IVF means that we take out the egg, we fertilize with the husband's sperm outside the body, we make a 3-day embryo, and we put it into the uterus. And there it implants and grows. In 50% of the women, 50% IVF does not succeed. Similarly, there are other treatments like laparoscopy, hysteroscopy, where we put in the camera into the uterus and see if there are any lesions. We can cut those lesions. We put in a laparoscope from the abdomen to check the tubes. If there are any ovarian cysts, we remove them. If the tubes are blocked, we can open the tubes. Of course, there is a failure rate to it also. There is also a procedure known as teaser. When the man is not ejaculating sperm, there are 0 sperms, then we try and take out the sperms from the testes if they are being manufactured there. If they are not being manufactured, nobody can do anything. But if they are being manufactured, we put in a needle and take out the sperm from there. We use that sperm to inject it into the egg and make a baby.
All right. That was really, informative. Is there anything a person can do to improve fertility?
So definitely, one is remove stress. That is one of the major causes. Take a good diet. Be aware of your fertility period. That is important. For a man, it is important that if he's on any medication which decreases sperm count, that must be removed. And one of the very common, medications for the sperm count being low is the anabolic steroids men take in gyms to make muscles. So there is a classic history that my trainer said, take these injections and I'll get strong. He does get muscular, but the sperm count decreases to zero. So this is one of the very important causes. So these are things to be avoided. Any medication which causes a decreased sperm count, or anything like smoking and all which decreases the egg count, sperm count, has to be avoided. A healthy lifestyle is very important. And having children in time is very important, because if you decide at the age of 40 to have a child, it will be difficult for you. So your decisions must be very right in this field.
Absolutely, ma'am. I won't take much of your time now. My last question from you is, you are a frontline worker, right? So as a frontline worker, what all COVID protocols are you following for your, as well as your patients and family's safety?
So, when COVID peaked, at that time, we stopped the cycles, because this is something which is elective. It's not something which is, so that 1 month or 2 months when COVID was at its peak, we stopped the cycles, because we found many women who were being stimulated were getting positive, and we had to stop because they wouldn't get anesthesia if they're COVID positive. But now, like, COVID has decreased, so we still follow protocols. Everybody is masked. We maintain a distance. Every alternate seat in the waiting room is empty. After each patient, the room is sprayed, and we ensure that there is sanitization is done. The lab and the OT is cleaned after each patient with with something known as cheif, which is not toxic to the embryos, but it can destroy the virus. So we are very, very careful. We always get a consent signed from the patient, explaining to the patient that you are undergoing this procedure, but this is COVID, and if you get positive, we are going to stop the procedure. And pregnancy and COVID is a dangerous situation. However, if you're willing, we will go ahead with it, and we explain it very nicely to the patient. And besides that, hand washing, distance, all that is, all the regular protocols are there. We also advise the patients to get vaccinated before they undergo a fertility treatment. And post vaccination, we advise them at least 3 weeks of gap before they start fertility treatment.
Thank you so much, ma'am. It was great talking to you. Our viewers, including me, actually really had a great insight experience into this issue after talking to you. We hope to see you in the next interview.
My pleasure being here. Thank you for having me on board.
And if you guys want to book an appointment of Dr. Surveen, you can do the same by visiting India Top Doctor.